Can you have both joints done at the same time? That answer is more, it's based on patient and surgeon preference. Personally, I like to give patients at least 4 to 6 weeks of recovery before doing the other side. But in certain situations, you may need to do both sides at the same time because it could be in the patient's best interest. One of those examples is if you have bilateral hip contractures due to severe arthritis, meaning that you're walking hunched over because you're having so much pain and deformity in your hips. If I fix one side and you're able to stand up straight on that side, and your other side is still very painful and that area is still has a deformity, it may be hard for you to walk. In those situations or circumstances, I would recommend doing both at the same time. But usually I like to wait around 4 to 6 weeks to give the patient a chance to recover from one side before doing the other side.